Okay,
Hi, everyone. We are officially starting the meeting at 5:10 on Wednesday, March 25th. Sorry about the delay. We had some technical difficulties. In attendance are myself, Risha Hess, Betsy Brooks, and Jack Jemsek. Pramila Nair is not in attendance, and we are also joined by our Public Health Department employees, Kiko Mellon and Maheen Ahmed. Um, So the agenda today, we will start with reviewing the minutes. I had one question, and that was to Kiko. In the minutes, it said that you went to the two adult-only smoke shops, and I had only remembered you had gone to one. Did you actually go to two, and that was just my memory?
I did go to both of them. Yeah.
Okay, so then it's correct.
Yeah.
Did anyone else see anything or have any other comments or corrections? Okay, can we get a motion to approve the minutes?
so moved.
Yep, second.
All right, and all those in favor say aye.
Aye.
Betsy, are you able to turn on your camera?
I'm trying to find I'm trying to find the screen so I can do that.
Okay,
I'm on my phone.
okay. Do you vote to approve the minutes?
I do.
Okay, so we have three people and it was unanimously voted, and that is three people is a quorum for the record. All right, our second uh, part of the agenda is public comment. I do see that we have someone in attendance, although they are marked the Amherst Indy, so I don't know if they are listening or would like to have a question. But we would take public comment at this time. Please raise your virtual hand and we can promote you if you would like to speak. And I don't see any hands raised, so we will move on to the next. There will be another slot for public comment at the end of the meeting. So we will go to old business. The first thing on the agenda for old business is the effective date of the approved Kratom regulations. Um, the we have had some comments come in from the town's lawyer in review of those regulations, and so we actually, and they came in today, so this is going to be moved to a topics not anticipated prior to 48 hours to the meeting. And so we're going to move that conversation down there because I think we can't really decide an effective date unless all of the other questions are resolved. So we will move that conversation till the topic's not anticipated. So for our old business, the only topic currently is the waste hauler update. And for that, I turn it over to Kiko.
Thanks, Risha. Oops. So I just wanted to keep the momentum going with this waste hauler update, and so with the whole waste hauler issue. So I talked to Paul Bockelman last week to get the latest on what's happening with this. We sent to you all as part of the packet just a reminder of how the board has been involved up until this point. Many of you are newer members and weren't involved initially when the board did weigh in. Back in January of 2022, I guess it was, the board made a motion to support the idea of a pilot project that would include curbside composting. So that was 4 years ago. And then the town council had been sort of bringing it up, and they referenced the Board of Health support for this, but then it really stagnated for a while. So we did have someone come to our meeting a couple months ago. I think it's been half a year ago. And as a result of that, you all, I'm just summarizing for the sake of context, sent a sort of letter of inquiry, what's the status of this? And then there was some progress as a result of that, I think. So you all heard that the town had entered into a contract with Pioneer Valley Planning Coalition, or Commission rather, to develop an RFP. So the person who was in charge at PVPC, Eric Weiss, he moved on. So there's a new person at PVPC who's working on this RFP. Her name is Mimi Kaplan. She's also someone who is doing the hazard mitigation plan for the town, very experienced person. I was in touch with her about the hazard mitigation plan, and I've been in touch with her recently at Paul's recommendation just to let her know the Board of Health's position on this issue. So I forwarded to her both the original language from the minutes in January 2022 of the board's motion, which was very simply, we support a pilot program with curbside composting, and then the other document that you had prepared earlier. I guess it was in the summer, August. So I wanted her to have all that information. So she has that. It was helpful to her. And what she told me in terms of status is that she's currently working on what she called a roadmap that provides options for the RFP for the Town Services and Outreach Committee to consider. So she's developing the RFP. That's not something she's just doing on her own. She needs to get a lot of she needs to put a lot of options in there for the town, the TSO, to decide on. For example, is it going to be weekly or bi-weekly pickup? What happens with the transfer station? Does that still exist or not exist under this new sort of proposal for a different kind of garbage pickup? So all of these kinds of things need to be figured out, put into an RFP, accepted by the TSO, so they need to review it, and then it would be finalized for the town council to vote on. So it's a bit of a process, but her contract ends June 30th. So this RFP for TSO review needs to be developed before that, or shortly before that, or definitely by then. So that's the time frame that we're looking at.
And sorry, you probably said it and I missed it. What does TSO stand for?
The Town Services and Outreach Committee. I think it's a fairly new committee that was convened to look at these kinds of issues, town service issues.
Thanks.
Yeah, Eric Weiss, he actually retired.
He retired. Okay.
Yeah, which is unfortunate, but a little hiccup.
Good for him.
Yeah.
It's okay. I mean, Mimi has a lot of expertise with this, and she, I'm blanking on her name, but the person who came, one of the people who came to our meeting to talk about this, Susan, I think her name is, who is very, very well informed, is next door, shares in the same building with her, so they have a lot of contact. So it seems like she's got good resources to develop this proposal.
Susan's the one from Amherst that worked for the town of Amherst, right?
No.
Oh, is Mimi? One of them, I thought.
You mean like a town of Amherst employee?
Yeah. I thought.
Mimi doesn't, but maybe Susan. It's not, yeah, maybe it's Susan. I'm not sure.
Okay.
I'm not sure. Sorry. So anyway, it's not a huge update, but I just wanted to make sure you all were informed that this is moving along and it's just taking some time.
Great. Thank you. And unless there is any questions from Jack or Betsy, the next item on the agenda is also for Kiko under new business, and it's the, do you say it's SAFE?
It's called, they call it SAFE.
SAFE.
Mhm.
That's a stretch, but okay.
I know. Yeah, it takes a little getting used to, but yes, that's what it's called, SAFE 2.0. So my original plan was to have someone from the Department of Public Health present to all of us about this legislation and about what it means for local boards of health. And it's a long story, but there was a bit of a miscommunication. So the person that I thought was going to end up presenting wasn't able to present. So I'm your presenter for today. And what I thought we could do is just, we sent this document from the Mass Association of Health Boards that outlines what SAFE 2.0 is. I've talked a little bit with all of you on and off about the Public Health Excellence Grant, which is a component of SAFE 2.0. And I just wanted to make sure that we all in this meeting have kind of working knowledge of what this is. So I'm going to just outline, sort of review some of the things that are on the document that we sent, and then see if there are questions. And somebody from DPH will come to our next meeting, or the May meeting if that's better, but we'll come to a subsequent meeting. They're prepared to come in April if that's what we want, to do a more formal presentation and to hear questions directly from you as the people who are really implementing this at the statewide level. So that's kind of the plan. Did people get a chance to look at the document that we sent? It was part of the meeting packet that Maheen sent last week.
I did.
Okay.
Yeah, I didn't get into it too much.
Okay, so I think I'm just going to do a brief overview, and then we'll have a little question and answer just to sort of prime people on what this is. So SAFE 2.0, it's pronounced SAFE. It stands for the State Action for Public Health Excellence. It is a piece of legislation that was passed back in, well, it started with it's been a long time in the making. So in 2016, there was a special commission that was convened, and they came up with a blueprint for improved capacity for local public health. So one thing that's in this document that I'm well aware of that you may not all know is that Massachusetts has more local public health jurisdictions than any other state. So we have 351 local boards of health. No other state has that many. We have a decentralized system, and frankly, it's not that efficient. There's a strong sort of feeling of, home rule and autonomy for small towns, which is really good. And I believe there's a way to preserve that while still having, I think many of us believe there's a way to preserve that sort of local feel and local autonomy while still creating a public health system that is more efficient. And this became extremely apparent during COVID when towns had to work together, because if you're a tiny town that has a part-time volunteer board of health member, that person is not going to be able to manage regulations, PPE, whatever it might be for their small town by themselves. So during COVID, people kind of informally came together, and that really laid the groundwork for, it sort of reinforced this whole idea of the need for more regional capacity building. So it's legislation. It started with SAFE 1.0, which was kind of the first kind of iteration, and then SAFE 2.0 has much more sort of teeth and details about what both local boards of health and the state Department of Public Health need to do to make this happen. And part of that has been the development of these performance standards. So the State Department of Public Health did a lot of research. There were many requirements that local folks had to meet. We had to fill out lots of surveys about, they wanted to know what's currently happening in your local board of health. Do you have the capacity to do this? How do you handle X? How do you manage Y? It was a lot for some towns to fill these things out, but they managed to get a considerable amount of data to sort of look at a baseline. What's our baseline capacity across the state from municipality to municipality to meet some of these core public health functions? And based on that information, they developed a whole set of performance standards. And that includes expectations for workforce. What kind of people do you need to be doing public health? What should their training be? What should their backgrounds be? What kind of skills are most important? And how can some of these needs be met by more regional connections? And that's where the Public Health Excellence Grant comes in. So the PHE grant is underneath this whole SAFE 2.0. It's a tool in the toolkit for trying to think about how we build public health capacity in Massachusetts. And it's a grant that's been made to the city of Northampton. This predates me. So this grant was in place before I moved back to Massachusetts. I'm sure there was a competitive process where people applied to be the recipients in a region for these monies. Northampton is the receiver of these monies. It's pretty steady funding. We're hearing that money hasn't gone away, so they're continuing to get these grant funds. I couldn't tell you how much it is every year off the top of my head, but what I do know is that it funds things regionally. So it funds our vaccine clinics. Amherst doesn't have funds to purchase vaccine. We don't buy COVID vaccine every year and hold our own vaccine clinics. Instead, we work with Northampton, and they use their public health excellence funds for their staff, materials, vaccine to hold a couple of clinics in our town. That's an example of how the Public Health Excellence Grant is benefiting us. In some of the really small towns that have restaurants, but a tiny board of health and nobody's school, trained in how to inspect restaurants or Title V septic inspection, Northampton has staff that go to those small communities that are part of this. It's called a Shared Services Arrangement, SSA. So Northampton is the lead of the Shared Services Arrangement. It's funded by Public Health Excellence, and they offer services to these towns that just don't have the ability to do that. Inspectors go out, they help with septic, they help with, housing inspections, food inspections, whatever it might be. And if they help people, if they can, to hire someone and train that person to do the work if possible. So it's just a sort of cohesive standard effort to have some standards. So, hopefully you have access to the same kind of public health infrastructure if you're in Cummington or Boston is the idea. And there's a lot of work that needs to be done to make that happen. And this is what SAFE 2.0 is about. So that's kind of the quick and dirty. I'd love to hear from you if that makes sense, if you have questions.
And this is a state grant, I assume, not federal.
State money. Yeah, it's
State
state
money.
money that supports the Public Health Excellence Grant and state money that's been put aside by the legislature to support this whole SAFE 2.0 effort. Yes, it's state money.
And is there enough money to actually do all of those functions that are under it?
So that is an excellent question to be asking of whoever from DPH comes to present to us, because I think, we're starting with the basics, which is let's figure out what people are doing already. And let's figure out let's decide what they should be doing. What's the best practice for public health? So those two things have happened. Now they're asking people again, okay, so let me just back up for a second. There's some surveys that are in the field right now, 2 surveys that every one of those 351 local boards of health needs to fill out. One of them is about workforce capacity, and the other one is about performance standards. So since you in Amherst, we have a board of health and we have a public health department. We have staff, Maheen and I. I'm the director. I'm going to fill out that survey. It has lots of questions on it, like how do you handle inspections? How many people are on your board of health? Do you make regulations? Right down to the nitty gritty of things like, when you elect a chair on the Board of Health, is that reflected in the minutes? They're asking some really detailed questions to understand how things are operating in different towns. So now when people complete that survey, they'll have an idea of what is the workforce capacity in each of these towns and how well are they able to meet these performance standards that DPH has established. Then from there, your question comes in, okay, we can see performance standards are being met here, not being met there. What do we do about it? And where's the funding to boost that capacity? I don't have the answer to that question. Excellent question to ask someone from DPH. Other thoughts?
That in the text I've seen, it talks usually about the Board of Health, but it feels like most of this is actually the Department of Health in our setting. Is that just because different towns have it differently, or?
Yeah, I'm really glad you asked that question. I think that's a continual point of confusion, is that people often use the term Board of Health and Public Health Department interchangeably. And that's because every town, every one of the 351 municipalities has to have some kind of health entity. And in the smallest towns, it's a Board of Health. It's called a Board of Health. And it is oftentimes a volunteer person, a retired physician, somebody who offers 10 hours a week or whatever it might be. And maybe they have a couple other volunteers from town who are part of this Board of Health. And that's it. They don't have a health department. They don't have a clinic. They don't have any of those things. They don't have an inspector. They're just a Board of Health. But in bigger municipalities like Amherst, we have a Board of Health, and you all are concerned more with policy and regulations because we have a health department too. And the health department is the one that actually carries out a lot of the services that support these performance standards that the health department wants us to see. So we say Board of Health, but because in some place like Cummington, it's going to be their Board of Health that will fill out the survey because there's nobody else to do it. But in Amherst, it'll be me who fills out this survey. But you're an important part of the public health landscape in Amherst, so I want everyone on the board to be informed about what's going on with this.
Great. Yeah, and the remit of the performance standards are, a lot of things we don't talk about.
Yeah, I mean, in some towns, and there are questions there about, questions like in the survey, questions like, does your Board of Health delegate responsibility to a health agent for things like restaurant inspection? And the question is, Absolutely, yes. Susan Malone and Grace Yan are agents of the Board of Health. They do all that work, restaurant inspection. That's not something that's expected of you. In other towns, there isn't anybody to do that, so the Board of Health members themselves do that work. You can see that it's just not the most efficient system, and that's why it's being looked at and hopefully, strengthened. The other thing I was going to mention is that, thanks, Betsy, for your question. It is state funding. If it were federal funding, we'd be potentially looking at a very different thing where, maybe the money wouldn't be available anymore for this type of work. But what I'm hearing is because it's state funding, it's been set aside, it's there. There's money to support this ongoing capacity building work. And there's money to support a data system that's called Metric. And we can ask the DPH folks about this because it's also another component of SAFE 2.0, is a standardized data system that everybody would be using. So right now, when folks do restaurant inspections, they may be keeping track of that with pen and paper. They may be using an iPad and some own form of their own devising. I mean, there are certain requirements of things you're supposed to look at per Mass Food Code, but everybody's recording that and collecting that in different ways. So there's no way for, let's say you have a Dunkin' Donuts in Hadley and then one in Northampton. Wouldn't it be great if you had a database where you could go in and see, are the same things happening in these two places? Or if there's a concern at one location, it would be good for the folks to know in the other city that there's a concern with the partner, entity that's part of this chain in another town. That's not possible now. But with this new system, Metric, it would be possible to sort of communicate across towns about shared concerns about particular establishments, and also just have everybody collecting the same data in the same way, which is much easier to prepare reports from a statewide level about what's happening with certain things across the state. Right now, it's just all over the map. So it's hard to get a good picture and report clearly and consistently about how public health is being, monitored with respect to these kinds of things in different places. So it's just a way to kind of make things improve this. It's a systems improvement effort.
I just sent the blueprint and made it like a lot smaller. It's only 2 megabytes now, for everybody's reference.
Was that
the 2019 blueprint for public health excellence that was footnoted on the first page?
Oh, okay. I see.
Yeah.
Okay.
Yeah. So but it was a bigger file, and I was able to reduce it to a smaller one. So
so everyone has that in their inboxes?
Yes. But yeah, good stuff. I love the sharing aspect of, out here in, Western Mass with the towns. And so I'm all for that. But I mean, I think other town services like schools and things like that would be nice if they could be in a cooperative frame of mind as well. But
yeah, well, it's helpful to have grants that support that kind of activity. The PHE grant has helped people to collaborate. So yeah. Anyway,
and I think that's sort of my reflection on it. Sort of, it's taken me a few years in this position to just get up to speed with what this board does, and it would be great to have organized ways that boards of health. I think it's worked for the public health department directors, but there aren't things that we engage with each other in. And it feels like that would be I can do it informally, of course, but it feels like if there's efforts to bring us together, it would be useful to also have efforts for the boards.
Yeah, I agree. Yeah, I think that's my question that I really don't have a good answer to, that I was hoping the state could really help with. And I've made that explicit request, which is that I understand how with these surveys that are out in the field, in small towns, boards of health are filling out these surveys. It's what everyone's really focused on right now. In our town, I'm letting the Board of Health know about the survey, but they're not filling it out. So what is the role for our local Board of Health in a town that has a health department and a Board of Health? How is there a collaborative kind of thing that can happen with similar boards of health across communities? Is there some other way for the Board of Health to be plugging into these regional activities? I would love to hear what their thoughts are about that, so that you all can feel a little bit more engaged. It doesn't seem, it's just not it's not a theoretical thing, but something that has some practical relevance for your job as Board of Health members.
Yeah. All right, well, we'll wait for those questions for when we get a speaker.
Great, thank you.
Yeah, thank you. All right, and you're still up, Kiko. The next agenda item is the director's update.
Thank you. Sorry to be doing all the talking. Okay, so just a couple of quick things then. For the infectious disease report, I didn't include it in the packet. I'm happy to send it out to folks. I don't want to overload you with things that don't seem relevant. So it's what I thought I would do is just kind of hit the highlights of the 2005 infectious disease report. There's not anything that's terribly noteworthy. I mean, the kinds of diseases that we're tracking are influenza, COVID-19, although COVID-19 is not really reportable in the same way that other reportable diseases might be, in that people can have COVID and test themselves at home, and that doesn't get reported. If you show up in an ER with COVID, they'll test you, it gets reported. So the numbers are not at all indicative of the actual kind of infection out there. Same can be true for flu. You know, there are lots of people who get the flu, don't go to the ER. So when we have flu numbers, it doesn't really tell us exactly how many people in our community have had flu. But that is one of the diseases that we track, and that is in MAVEN, the epidemiological network database that we use, that Olivia, our public health nurse, uses. Other ones include, you know, vaccine preventable illness like measles, pertussis, varicella, all those we get reports on. Nothing out of the ordinary, no extraordinary numbers of cases in the last year for any of those. GI illness, we also get reports on, everything from, you know, Campylobacter to Giardia to Salmonella. Again, nothing really, not huge numbers, nothing, some norovirus cases, but not anything out of the ordinary. Just 8 cases out of 66 regionally. So that sort of makes sense for the size of our town. The one thing I did note that I thought was worthy of mention is that in 2025, there were 347 reported cases of Lyme disease, and 99 of those were in Amherst. So that's a pretty significant number. Yeah.
Wow.
And Olivia does certainly see her fair share of tick-borne illness that she tracks in MAVEN, and has conversations with people just to make sure that they're getting care and they know what's going on. And you know, tick season has started already. I've seen a couple. I've pulled a couple off my dog already this season. So, you know, this is, even though there was heavy snow, what I learned is that heavy snow actually kind of serves as an insulator for ticks, and it helps them to get through the winter. Whereas there weren't as much snow, then the harsher temperatures might have killed more of them off. So we're prepared for an intense tick season. I'm just kind of segueing into the next item from infectious disease report. I can stop for a second if anybody has questions about what I just.
I mean, I kind of can say that I have Lyme disease and been struggling with it. And my brother is he's retired, but he was a well-known Lyme disease. They call them Lyme literate, doctors. So, yeah, if we do much on this, I know a fair amount because of my circumstance. It's a real difficult situation, as a lot of diseases are that aren't mainstream. So Betsy probably knows how some things are easy to treat and others are difficult, and
Right.
you just kind of ignore them.
Right.
Yeah.
I was curious, do you think it's a reporting issue that Amherst has so much higher of a rate, higher numbers? Is it the demography of our group, or a reporting issue, or a testing issue? Or do you think there really is a different...
Are you trying to get at whether there's actually more Lyme in Amherst than other communities?
Yes, are you capturing that data more effectively than
Yeah,
elsewhere?
it's a great question. One thing that I've been trying to do is reach out to the tick lab at UMass because they do a certain amount of tick surveillance. So they have folks out in the field. And Risha, I see that your hand is up. Sorry, I'll get to you in a sec. But I see that they have, researchers that collect ticks and try to look at how many of them have Lyme. And I don't know if they do that just in Amherst or they do that in the region. So that would be a piece of information that I would like to have as public health director that would help to answer that question. I also think it's probably somewhat likely that people might be more, I don't know, in Amherst more likely to seek care, possibly, so that maybe cases are caught more. I don't know. It would be a good question to pose to the folks at the state, who look at these data more closely.
Yeah, it's hard for me to think about why it would be a different rate within Amherst other than a rate of testing, diagnosis, or seeking care or something like that. That the ecosystem is largely the same.
Yeah, I think the ecosystem is the same. I don't know if people in Amherst are more likely to be active and out in the woods and hiking versus people in other places. I mean, there's so many things that it could be due to that I don't have the answers to. But I think it's worthy of understanding better. So these are good questions that you're asking. Risha,
Yeah.
go ahead.
Oh,
Um, I had a question about reporting, and it comes because a family member in Amherst found a tick on them the other day, but they happened to be in Boston when they found it, and so reported to the emergency room there. What happened? Does that get reported as an Amherst number?
Yeah,
But
because
it would have to be in state.
yeah, I mean, if you are, yes, that's a good point. So if you're an Amherst resident and you get a tick bite, if in Massachusetts, it's going to get into the virtual network, and it would come to us because it has an Amherst resident. So even though that is if the person ends up testing positive, if it's not, then we wouldn't know anything. But if they test positive, they would probably get treatment in Boston, or depending on how long they're there or what have you. But it would come to us for the follow-up because it's an Amherst address. If it happens out of state, we may or may not know about it.
Okay.
I was just going to add that I do think that Amherst has a little bit more of a kind of grassy feel versus like some towns are just totally wooded. And I think with regard to grasses, walking through grasses, whatever, I think so we have so many recreation areas that are like that. We have higher population that than the surrounding towns. And, I can see how there's an environmental factor. So I wouldn't discount that.
No, you're right.
Possibility.
Absolutely. I
Yeah.
misspoke. Yeah, that's definitely true. And I know that for Northampton, they have that huge what's it called? That big empty space just right as you're going into the Meadows or something like that, I think it's called, as you're past 91 on the left-hand side, big open area, old fields. A lot of people walk their dogs there.
Yeah.
But that's like a mosquito breeding ground. So
Mhm.
Northampton has more challenges with mosquitoes than we do here in Amherst because that's a very large area of space where
Mhm.
mosquitoes might breed. So there's absolutely different ecosystems from town to town. And you're
Yeah.
right about our conservation areas and grassy areas and stuff like that. But I'm really glad you all are asking these questions because this is an important thing that public health does, educating people about tick-borne illness. Tick-borne illness, as you pointed out, Jack, is really no joke. It can really, it affects people's lives over a long period of time. So I'd like to understand this more, and I feel like it's something we can do more work on.
Yeah. I mean, I've seen someone in Northampton, therefore, that's a Lyme literate, and she ended up getting Lyme.
Oh,
I'm
boy.
seeing her. It's like
Yeah.
the irony, but
Yeah.
I mean,
Oh,
I did
gosh.
see that they completed phase 3 trials for a vaccine that seems to show promise. So keeping
That's
our eyes on
right.
that.
Yes, and
Yeah.
who's going to be deciding if it's safe?
Oh,
Isn't that interesting?
mm,
There's no body right now, right? The immunization advisory committee was dismissed, I thought?
No,
No, no,
it
no.
exists.
Well, they
So-
were dismissed because it was improperly staffed.
Constituted, yeah.
But but I'm pausing because I'm not sure. I understood that they set sort of routine schedules, not whether something was approved or not for use. So I think it's a different
Those are different
regulatory.
bodies.
I think so,
So,
but
yeah,
I
you're
feel
talking-
very.
I think you're
Go
talking
ahead,
about ACIP, right? The Advisory Committee on Immunization Practice. That's the body that RFK disassembled and then appointed
Back
new
and then,
people to.
yeah.
Yeah. That I think Risha's right. That's really about practice. Like, what do we recommend in terms of how often to get these shots, which shots to get, versus is a new vaccine safe? That wouldn't be under their purview. But to make a recommendation about how often people should get it, that would be under their purview. And so it's still a question as to what will happen with this vaccine in terms of getting out to people and who will be making the recommendations about its administration.
Yeah.
Yeah.
And whether it's covered by insurance.
And whether it's
covered by insurance.
Exactly. So the other tick-related piece of news is that the Department of Public Health recently sent out an alpha-gal advisory. So alpha-gal is a syndrome that comes about as a result of a bite from the Lone Star tick. So it's not actually an infectious disease, and it's not a virus, but it is a sort of a enzyme that gets produced. Are people familiar with this?
Yes.
Yeah. Okay, so you're not, Risha. I don't know that much about it. I can share the clinical advisory with you if you'd like to see it. It's kind of interesting. But so there's a reaction that happens as a result of getting bitten by the Lone Star tick. It doesn't happen to everybody, but it can cause an allergy to red meat and other animal products, which actually can be fatal. There was a report recently of somebody who died as a result of this syndrome after being bitten by a tick. And it wasn't really a concern so much for us in Massachusetts because the Lone Star tick wasn't one part of our flora and fauna here. But now they're finding those ticks in Barnstable County and a couple other counties in sort of Cape area in Massachusetts, enough so that it's now been added as a reportable disease by the DPH, in addition to Lyme and anaplasmosis and babesiosis and some of these other tick-borne illnesses. So that's just another concern about, adding to the burden of tick-borne illness potentially in our community.
What's the tick that spreads Lyme?
It's the deer tick or the black-legged tick.
That's the deer.
Yeah. So
I appreciate that these have common names because I'm used to mosquitoes and they do not.
Yeah. Right. And speaking of mosquitoes, it's not mosquito season yet, but we still have our contract with the Pioneer Valley Mosquito Control District. They do some work in the off season, but they'll be gearing up with the surveillance and larval mitigation treatments come June. And it'll be, June through October, they do that mosquito surveillance. So testing mosquitoes for West Nile and Triple E to see what our prevalence is. So that'll be happening pretty soon. I'll move on to the next one. So Valley Vax, the website is getting a lot of attention. I'm going to a conference tomorrow. It's the Mass Adult Immunization Conference, and Valley Vax was actually we're going to be receiving an award, a Vaccine Champion Award, which is lovely. And we'll have an opportunity to have a table there and get more people aware of the website and the resources, and the fact that we are trying to make it as interactive as possible. So we have a question and answer feature. I've been really good about checking it every day. If people have a question, trying to write back right away and posting the answer also on the website, so it can be an evolving kind of place for people to see questions that folks have in the community about vaccine. So we'll be trying to do some more outreach events come with the weather being better at the farmers market and other places, just to drive people to this website as a source of evidence-based information about vaccines.
Excellent. How many people have visited so far?
Oh, good question. I haven't looked at the data recently, but when I checked a month ago, it was getting some pretty good hits. If I can look at my phone and try to figure it out, or I can.
Is it on the order of 10, 100?
No, it's more like hundreds of hits. Yeah, I would
Hundreds of
say
hits.
hundreds of hits. Some pages looked at more than others. Yeah.
And is it most of the interest in the pediatric vaccinations or adult vaccinations?
I don't know that I have data that can answer that question. I could look and see. The website is sort of very pediatric focused. It's got mostly
Mhm.
pictures of children. We have a lot of, kind of attention paid to that because it was a bunch of pediatricians that really got it off the ground.
Great.
But most of the questions that we've gotten have been about adult vaccines.
Right. And John is probably, having his practice, directing people in his practice to that site. I would
Exactly.
guess.
Yeah. Right. Yeah. Okay, other quick updates. Jack and I have met once about the well regulations, so we'll be continuing to work on those. We don't have anything to present to the board yet, but that'll be coming. We have been making a plan to get more Narcan out into the community. So we have now some Narcan cabinets that we're going to be putting outdoors. I think one at Mill Valley and one at the little park here right outside the Bangs where a lot of folks hang out. So that there's access to Narcan after hours when this building is not open. But we also will have a Nalox box in the building and a couple other places in town hall. So we're just trying to get that out there. And we're going to put it near the AED. So we have AED and Nalox box together in all the town buildings. Yeah, so that's good. And speaking of AED, I don't have any updates on that, but Betsy, we should probably talk offline about how we can get that moving.
Great.
Yeah, at some
Excellent.
point. So I'll make a note of that.
Great.
Question.
Yes.
What is the Narcan again? I'm
Oh,
not ringing a bell. Should, but
Narcan.
It's the thing that reverses an opiate overdose.
okay.
Yeah.
And
Kiko, which park are you talking about that's near the Bangs? Is it the one in front of the police station or the one between Bangs and the senior center?
It's the one, do you know where Masuda's Cafe is?
Yes.
Right there. There's a park right, if you're
That
walking,
tiny corner.
tiny little park.
Okay.
It's Triangle Park. It's tiny, but there are always people there.
Okay.
a lot
just
of
for
them
the
are
record.
adolescents.
No,
No?
not recently. It's a pretty consistent group of people, sort of middle-aged folks. Definitely people who use drugs. I've seen some drug using activity in that park. People that come into the Bangs we know well. We just want to make sure people are safe,
Yep.
So yeah.
That's terrific. That's a really good thing.
Yeah, I think so too. Also, other good news is that we will be doing interviews next Friday, Risha and I, for a new Board of Health member. We have some good applicants, so hopefully we will have, I think for the May meeting, a new board member. Probably not in time for the April 15th meeting, but that's moving, so that's good news. I think that's everything on my list. Oh, and just so you all know, I am the interim senior center director again, in addition to being the public health director, because our senior center director resigned. So we're looking for a new senior center director. So I'm wearing 2 hats again, hopefully for not as long a time as last time.
Somehow it still feels like we're a small town, even if we aren't quite the smallest of small towns.
Yeah.
Mhm.
Okay. Thank you, everybody. That's all I have.
Thank you. All right. So I mentioned at an earlier time in the agenda that we got some feedback on our KATAM regulations from the town's lawyer today. And so this is a topic not anticipated within 48 hours, but it seems important that we discuss it today because I know that we're trying to get these across the line and signed, and there are some issues we need to discuss before we can finalize them. Kiko, do you want to summarize or shall I? I'm happy to.
Yeah, I can summarize. I can start. So how this came about is that I had an opportunity to meet with our town attorneys, which is not something that I normally get to do, but they sort of had an open house. And I sat down with them and said, so here's one thing I thought you might want to know about is we do these regulations. We have tobacco and kratom regulations. And they said, oh, yes, please do send us those. In fact, it's really a good idea for town attorneys or for the town attorney to look at regulations that the Board of Health develops before they're approved and signed.
Oh.
So that was just something I wasn't aware of. It makes sense. We're making policy. You all are making laws, and so it makes a good sense. If we had an attorney on the Board of Health, maybe that person could be the one to review, but we don't. So I think in future we do want to run any regulations by the town attorney. So they looked at both our tobacco regulations and our Kratom regulations, and the tobacco regulations are fine. There's nothing wrong with them. There are some recommendations they would have made, some changes that they would have suggested, and that's something that we can talk about in the future. It's just interesting to hear their perspective on some things like the fining structure. But as she said to me today, there's nothing wrong with what you did. You just might want to think about it differently in the future, and we can meet with them and they can come to a meeting if that's something we want. So, but through this conversation, actually, as I was writing an email to them to say, here are the regulations per our conversation last month, I caught a problem with the regulations that I didn't think of when we met last, when you all approved them, which is that there's a definition of adult-only retail tobacco establishments that we are using in this regulation that describes an adult-only store. The regulations that you approved said that natural leaf kratom could be permissible, but only to be sold in adult-only stores. But those are defined as a tobacco establishment, adult-only tobacco establishment. We had a long conversation about Wildside and the products that they served there, or that they sold there, and how knowledgeable the staff were, thinking, I think, all of you, that the products would be available for sale at Wildside. They do not hold a tobacco sales permit, so they do not fit under that definition of adult-only tobacco retail establishment. So as these regulations are currently written and approved, these natural leaf products could not be sold at Wildside. It's an oversight. I didn't catch it in the moment. So Risha and I talked about how wanting to hear from the board about whether that changes people's thoughts about these regulations as written.
And I'll just add to that, so if we keep them as written, it means there's only one store that would be allowed to sell unadulterated or natural kratom. And as Kiko reminded me, we had conversations about wanting to avoid monopolies in thinking about tobacco and how we regulated some of those products, because it will essentially say there is one place in town that can sell this, and we aren't issuing any new tobacco licenses, so there won't ever be more than one place in town that could sell this. So that's one side. If we got rid of the tobacco and just said adult only stores, that doesn't exist as a category. There isn't an official definition of what an adult only store would be, nor is there any oversight or regulation or licensing of such a thing if it's not a tobacco retailer. So there's not an easy way to just get rid of that tobacco retailer bit and solve the problem. So I think we either go with how it's written now and it becomes only one store can do it, or we rethink how we want to regulate the natural product. Those to me seem like the two choices.
So the ones I'm trying to hold this in my head. I mean, I think the why do we think that dispensaries in general do hold a license and do have the knowledge to dispense kratom knowledgeably? Is there a category of adult-only dispensaries? No. Do we feel like there is how have other towns dealt with this? Do they not have the same structure of the market where there's only a single?
We were the only ones that tried to do this adult-only compromise. So Northampton has banned everything anywhere. To my knowledge, we were the only ones that said adult only is the solution to this.
Mm-hmm.
And the only thing that has changed is that there is one, not two, adult only, because Wildside does not sell any tobacco products.
Mhm. And do we feel that the other store that does sell adult only also has knowledge of the how to use this product safely? You know, I know you were
I
very impressed with the knowledge that the
I guess I would just voice concern that it's less does this one and more is this, yeah, I guess they're
that
going
the
to have
correct
more knowledge.
distinction.
They're going to have more knowledge than a Cumberland Farms employee.
Yeah,
Whether that's adequate to our desire, we wouldn't have a way of knowing other than to go and ask.
yeah, yeah.
And then how do we maintain that? Like, is that a criteria for maintaining the ability to sell is a whole other thing.
Yeah. I still like the idea that a teenager can't go into a store and buy something that is potentially dangerous and the employee has no knowledge of the risk that that particular product has. So I think fewer places to buy it. I don't like the idea of Cumberland Farms and places like that being able um, to sell products. So I think I would tend to personally um, because of the confusing way these products are packaged and labeled, I think that's a problem. And I would tend to be more conservative about what's allowed.
My gut instincts are to get something across the board now. And so that might be the most conservative version. We could just take out the loophole for natural kratom. It could be to go in the direction that we already did, which was to say it can be sold at adult only tobacco retailers. That does mean it's just one, not the two we thought, but and just get it across for now. I feel like there is, Kiko mentioned that for Wildside, we're not just banning kratom, we're banning all of the synthetic cannabinoids. And apparently, all of those things combined is a pretty significant part of their business model. And so I do think we should have a discussion with them and maybe Lazy Lungs as well and understand how we can, if our intent is to allow, some sort of 21 plus version of this, but if our intent is to keep it available but regulated, is there a way we can do that and sort of work even? The problem is it does mean that for at least for Wildside, it would mean that all of this stuff goes at least temporarily until we solve this with them.
Yeah.
I think most of it's going to go even regardless because we're not trying to create loopholes for all the other stuff. We're really just trying to create a path for natural kratom to be available.
Yeah. And yeah, and yep. I think I agree with your proposed compromise because the alternative would be to say, well, maybe we don't just allow one single adult only tobacconist license so that other people can have the expertise that's required for this product. I don't think we want to go there either. So it's complicated.
Well, and Kiko said that now I've forgotten the name of it.
Wildside
Side is they used to have a tobacco license and gave it up. So it isn't the business model they wanted to go after.
Yeah. I honestly felt like when we looked at the packaging things, And, you know, of our expert people that we were asking, some said, yeah, that's exactly the kind of stuff we don't want to be available. And other people said, oh yeah, that's a good product. That's the problem. And we don't, I
Yeah,
I
they-
think being conservative on that is a good thing until there's more
Yeah.
information.
Jack, do you have any
I don't,
inclinations?
um, I don't have any strong, opinions.
So I think,
Can I just add one other thing?
Yeah.
So, I mean, in the interest of passing something and taking this over the finish line, like you're saying, you've posed two options. There's a third option, but it would not support that goal of finishing this now, which is developing some language around adult only stores that, you know, head shops, for lack of a better word, that could be approved by, you know, a set of criteria the Board of Health would outline. This is the kind of shop, this is what they have to do, and it would be approved by the health agent and the Board of Health. But that would be a chunk of work, and that would then allow Wildside to sell this stuff because it's not currently a tobacco establishment. But that wouldn't support, like I said, this goal of getting it done today. It is an option, maybe for the future, if that's something people wanted to do.
but I think part of why we wanted to do it through the tobacco adult only stores, and part of the reason that I'm guessing here that Wildside didn't want to have a tobacco license is because we have a mechanism to license and enforce that with a tobacco store, right? So there's all of the things that they have to do and that they have to comply with. None of that exists outside of the tobacco license. So this other, you know, Wildside and any other store like them can just exist. They don't have to be licensed to sell those. And so our regular inspectors wouldn't necessarily be going there. You know, again, it sort of falls outside of the purview, which is, I think, part of what, you know, they're going for, to not have that kind of licensing, but it makes it much harder from our side. I think it would be a hard lift to get something like that defined and enforced then.
Yeah. Ooh, this is tough.
I mean, again, the enforcement is hard no matter what, because non-tobacco retailers can always just sell something. And the only way we would know that is if somebody reports it in.
right.
So I guess the three options are pass adult only tobacco allowance for now, pass a complete ban on all Kratom products for now, or go back, have the discussions, and get it right from the start. Because those first two, I think we agree, are not ideal. We haven't put a lot of specifics in. The urgency is more to get it off the shelves of places, because right now there are no age restrictions on it, and no restrictions for who can sell it.
Yeah, and as you had said, Risha, if we do the first, if we say it's adult only, that would mean these products could only be sold at Lazy Lungs. So it would mean a significant chunk of inventory would come off the shelves at Wildside. It is a big part of their business model. I don't know what that means for their continued, you know, livelihood as a business, and whether that would be a potential problem. You know, if a Board of Health regulation means that a business shuts down, that could be an issue. Just saying, I don't know. So is that somewhere that you want to go?
That's
I
the
think it's
same for
important for people to
the
ask.
first and second option, isn't it?
Yeah.
I mean, that
If we
doesn't
ban
change.
Kratom outright, the same thing applies.
Yeah, that's true. You're right.
Yeah, there's no difference there. So I think the question is the reason to ban the synthetic kratom sufficient, even if it means what Wildside is put at risk?
Yeah.
And I think legitimately, I don't want to put businesses out of business. That's certainly not our goal. I think we should have, regardless of which choice we go down, reach out to both officially and have sort of official conversations with them around what is there something we could come up with that would keep safety in mind and still allow
Yeah.
them to run a business model. I think the question is, are we willing to pass things that cause the problem for them first,
Yeah.
and then have those conversations, or should we have those conversations and delay the restrictions for everyone else?
That's well put, Risha. Thank you for that. Jack?
What would it take for Wildside to change if they had a desire to?
No, they can't go back to selling tobacco if that's what you're asking. There are no more tobacco retail permits available.
Ah,
Yeah.
It would take some sort of new licensing structure.
mhm.
Yeah, it would take a definition of yeah. So can I just say one thing though? I think Betsy, you pointed something out that's really right, which is that if you go with either of the first of those two options, it still results in lots of things not being able to be sold at Wildside. If you went with a third option, which is that you wait, get it right before doing it, then you could potentially devise some kind of type of shop where kratom could be allowed to be sold, and then they would have kratom on their shelves, but the other products, the cannabinoids and the other things, would have to come off, but they could still be like the premier kratom's retailer. But you'd have to develop a type of shop to be covered under this regulation for that to happen.
Yes, and do we really think that is something, is waiting and getting it right really meaning doing something that's really not that actually really is not going to happen ever? I mean, honestly, to create another class of license and a structure to.
Yeah, I mean, the attorney
Wait,
said it's possible to do it. It just would take some work. Anyway, sorry, go ahead.
So Northampton, what is their?
They banned it all.
They banned it all. They banned it all for everyone.
Yep.
I remember just hearing that compelling testimony of someone in the Northampton community who had an adolescent death related to synthetic kratom.
Yeah.
So I'm forgetting from your inspection whether we were seeing inappropriate products on 7-Eleven.
Yes.
Yeah, we were seeing inappropriate product in convenience stores.
Yeah.
In bulk. So I think that's really really
the
a
worry.
problem.
That's the worry. Yeah.
And I think sitting that on the side, I mean, I think I would.
What if we took all references to natural kratom out, and so this only bans synthetic? It bans it everywhere.
Yeah.
And all the other cannabinoids, the synthetics.
Yeah.
And for now, didn't touch the natural kratom until we could get it right. Would that be getting it over the line, but not putting somebody out of business in the meantime?
Yeah. The question is the enforcement on that.
It wouldn't be, but I think that the stuff at the gas stations is so obviously synthetic that would be very clear that it would need to get off immediately. That there isn't clarity in our guidelines about what's natural and what's synthetic, and therefore the adult only could make their case that it says natural and therefore it's natural, while we have conversations with them about how to do this in a safe way.
I mean, would we actually then have inspectors go to gas stations and see whether they're selling synthetic?
Yeah, we'd have to do that.
I
And
mean,
it would become public. So again, the public could be informed to report it.
Yeah.
Yeah. This was one of the last credible FDA things that I got as a physician when they were saying, there's a real problem with this synthetic material and people are dying. So, um,
Yeah.
so I think that priority to have a mechanism if we're saying this stuff is not covered by the regulations, but the places that are selling it don't have a tobacco license or something like that, that's a real hook for inspections and gives them a reason to comply. That's the whole problem. There's no regulatory structure, right?
I mean, there's fines, there's blah blah blah, but yes,
But there are
we can't
fines.
pull a license.
Yeah, but there are fines, like you could go look at the gas station and if they're selling synthetic kratom, say
Oh, well,
you're
so
being
at a
fined.
gas, let me be clear on what we're saying.
Yeah.
So under what scenario are you talking? What would we pass today?
If we passed a ban on synthetic kratom, what
Okay,
would
so
be the
yes,
penalty be for not obeying that?
in our guide regulations that we've drafted, we had suggested a $300 fine for each instance, and a suspended. I forget at which point, but there's a suspension of license, and so again, those were mostly tobacco if you have it, or food if you have it.
Correct.
Any
That's
license
right.
the town offers.
Uh-huh.
So for instance, Wildside has none of those licenses. The threat of taking away those licenses does not apply to them, but the fine would still hold.
That's right.
Well, I guess that's something.
Yeah, so Risha, you've made a good suggestion, which is that you all take out all reference to natural in the interest of getting this done, because you had
For now.
approved to approve it. So that you take out all reference to it's a little fuzzy. We're admittedly a little bit fuzzy because there's debate about what's natural, what's synthetic. It would be up to us to kind of establish our own checklist when the inspectors go out. What is it that we're pulling? What is it that we're leaving? It would sort of be up to their discretion, which is not great, but it's an okay place to start if people feel comfortable with it. I think the other question do you want to say something?
Oh, I would just say I think there's some pretty wide agreement on the things that I saw at a gas station being synthetic. Nothing there claimed it was natural. It
Yep.
didn't say natural on it. So I think
I
there's
agree.
some stuff, and maybe the worst of it would
Be
go
off the shelves. I agree with that. I definitely agree with that. Because then the other question that you posed about, do we want to pass something that is going to possibly affect businesses negatively now without talking to them and talk to them afterwards, or wait, get it right, tell them we're doing this and then pass it? I think the other thing that you propose, which is just to take out all reference to natural, kind of, changes the need to answer that question, I guess is what I'm trying to say. Does that
I
make
think
sense?
so, and I'm proposing it as a first step,
First step, yeah.
and that I would very much like you, me, so Kiko, you, me, and maybe the lawyer and someone else from the town to meet and understand what would it look like to have a different definition of an adult only store. What is possible there, because I don't think I understand the possibilities, and therefore it's hard for me to understand what we could do.
Yep. I think that's a very good suggestion that you've made.
Because Betsy brought up I think it was Betsy, sorry if it was Jack, brought up the marijuana dispensaries. How does that fit into all of this? I think it would be really useful to sort of sit down with people who know some of this regulation better.
Yeah.
So my proposition is we take out all reference to natural and just ban synthetic at this point.
Mm-hmm. And we're
How do
thinking
others feel
that,
about that?
and we're thinking that dispensaries actually might be an appropriate place for the natural product to be
No
sold.
idea. I don't understand anything about the regulation about them, so I can't answer
Yeah.
until we ask better
Yeah.
questions of the.
Yeah.
I agree with that answer, but just to clarify, Betsy, when you say dispensaries, are you talking about cannabis dispensaries? What do you mean by dispensary?
I'm thinking cannabis
Yeah,
dispensaries.
so they don't currently carry anything but cannabis products. Kratom, as far as I know, is not on the shelves in cannabis
Uh-huh.
dispensaries. It's not something that we have purview over, and it's not something that we're dealing with at all. They're not under
Yeah.
our,
They're under some other.
they're under the state. Yeah.
And has the state, I mean, again, this is one of those things that I can imagine that the state would have some sense of how this this product should be regulated and who should be able to sell it. Ideally, but that's not going to happen.
I mean, they might have opinions, but that's
But
not
they-
how this is getting passed.
That's not
Right.
how this is getting
Nope.
passed. Yeah.
No, yeah. Okay.
Jack, how do you feel about just allowing the raw kratom anywhere at this point, banning synthetic completely until we can figure out if there's a way to better regulate the natural?
Yeah.
So natural
You-
allowed, synthetic not.
I don't know. I feel like it's I'd hate to ban it, but I mean it seems like a lot to manage because of all the uncertainty and the burden on the health department to monitor and ugh, um no, but I think what you have said makes sense to facilitate getting something out there that is a little bit more more easily interpreted, I guess. So is that something that we do like now, today, or
We have a draft, and so the only edit that needs to be made is that right now it says we're making a carve out for natural, and it is only allowed in adult only. And so rather than we wouldn't even discuss natural, we're only banning the synthetic forms of all of this. And for now, natural can be sold wherever it wants to be. And then again, our understanding is that we have further discussions to understand what the implications are.
Yep. And just to chime in, the health department is happy to make this happen. We have concerns about these products that are on the market, these 7-OH synthetic products. They're dangerous and we want them off the shelf. So we'll make it happen. It's important.
Do you think a third option would be you have that discussion with the town lawyer and the parties, and on the next meeting we get something over the finish line, but do that piece of work before that?
So the town attorneys had originally said, when I told them we've already got a draft of kratom regulations, they said, you're welcome to pass those as they are. So with the attorney having weighed in on these, she didn't say you can't pass these the way they are. She said the fine structure that you put in there is okay. We had encountered this issue with the adult only thing that we've been talking about. And I think Risha's come up with a way to get around that. I think you all share the concern of wanting to get those synthetic products off the shelves because of what we've heard about how dangerous they are and the evidence that supports that. So we don't, if we delay and I think it makes a lot of sense what Risha said, to have a more in-depth conversation with the attorney, but that would be a really in-depth conversation. And I think you all have been trying to push some regulation of these products for some time. I would support that happening. It's obviously your decision, but I would support that happening and having further. She had said, you can do something now and you can change it up later. Like that's something that's okay to do. This is a first stab. It's a pilot. You can change it up later.
Okay.
So do we want to make a motion to pass the regulations just banning synthetic?
So moved.
There's only one person who can second.
I'll second, but again, I'm finding this confusing. I'm sorry, I don't know why, but
Because it is confusing.
yeah,
I mean,
well,
it is.
and I don't have the regs right in front of me either, or what but so natural kratom, we banned the synthetic. The natural kratom is sold where?
Anywhere.
Anywhere.
Yeah.
And,
I mean,
and
so
you're,
Jack, can I just say, because I know it's confusing, like as Risha said, it is
Yeah.
confusing, but I want to remind you all of what you had really reached consensus on last time, which is that these synthetic, everything we've heard and read about synthetic 7-OH products is concerning, that anybody, any age can
Yeah.
go into a store and buy them. As a Board of Health, you felt like we don't want to enable that. Let's do something to stop that. That's what these proposed changes would do. Get those things off the shelf. The natural stuff could still be sold anywhere, but from what we're hearing, that's less damaging. Maybe still problematic, something we could revisit later, but at least we can get these things that we know are bad out of circulation now. That's what we're trying to put it on today.
Didn't we find like the natural really isn't even it's not really on the shelves per se? I mean, it's rare that you find.
There's a question of what is natural, and I think that's
Yeah.
where the real confusion comes in, and that's where we didn't know how to define it, and so we just said natural, and we sort of punted that decision to down the road, and that will remain here, which is, if it says natural, it probably just is going to be accepted as natural at this point until we're better able to put specifics of labeling and what we would need to see.
Yeah, yes, I remember now. Well, it's kind of coming back to me. False advertising sort of thing. Yeah, came up. We did discuss that. How do you monitor the quality of these things? Yeah.
Yeah, exactly. So you technically said you seconded. I just want to make sure you really second it.
Yeah, no, I second it. Yeah.
Okay. So all in favor of banning synthetic kratom and all synthetic cannabinoids?
Yes.
Great. And Kiko, I will reach out to you to set up. We can figure out who needs to be there. I think it's at least a 2-part conversation, one with the owners of the 2 stores to understand what their feeling is on all of this. And then the second would be with folks who understand how all the regulations of all the various places work and what is possible given that.
Okay.
I don't think it will be ready by next meeting, which is in 2 weeks. So I think it's the meeting after that would be our goal.
Yep, I think that sounds right. And let me also just ask, the DPH is poised to come to the April 15th meeting, which is also a virtual meeting, which suits them. So does that work for everyone to have a further conversation about SAFE 2.0 with DPH at the next meeting?
That's on the 8th, not the 15th.
No, I have the 15th. Maheen, can you chime in? Is that not, am I wrong?
Oh, no, you're right. I have a different
the second
board meeting.
Yeah, okay, it's all right. It's
Well,
the 15th.
it should be the 2nd, right? Is that?
Originally, I believe it was, but we changed it. Wait, let me
Yeah, it's all over the map the next few months.
Yeah,
May's
it's
the
true.
1st.
Because there's some holidays, so that was the problem.
Yeah.
Yeah, April 1st is the first day of Passover. That would have been our meeting, April 1st. So instead, we're having it on April 15th.
Okay. There's one more part of this conversation, though, and that was the original thing on the agenda, which is when the effective date of these regulations. So what this means is as soon as we put it effective date, the stores will have to clear the shelves. And for many of these stores, that's a significant bit. So we have urgency that we want to get this stuff off the shelves. We also want to make it reasonable. I don't really have a first idea of what would be, we always like to make it a round number, like the 1st of a month. Well, the 1st of April is next week. Is that enough time? Do we have to publicize it for longer than that?
This is where this gets very muddy again, because how are they finding out? We have a way of people who hold a license getting a mailing saying you have to, right? But do we
Well,
have
it
a
will
way?
get published, right? We have to put out a notice in the newspapers
Yes.
when
And
any
is
new
that-
regulation gets.
Yeah, is that sufficient to reach the
Well,
convenient,
I think what we can do is, so yes, there will be a notice in the newspaper. I don't know how many people read the newspaper anymore, but then we will also send out an email to all of the establishments, that have tobacco sales permits. We can do that because we know that there's overlap. And then the only other establishment that I know of that doesn't have a tobacco sales permit that sells Kratom is Wildside. Are there other stores that sell? I don't think so, but I can talk with our inspectors and see what they
Yeah,
what they
I thought
think.
we were saying that gas stations and convenience stores had them.
Yeah, they also
And
have
most-
tobacco sales permits. They have tobacco sales permits.
Oh, those
gas
are all,
stations and convenience stores in our
yeah,
community.
okay,
Yeah,
yep. Okay,
most of them do. I don't think there's one that doesn't, but I
okay,
could be
that
wrong, but
makes
we can
it,
check that. Yeah,
yeah, that makes it easy.
yeah.
So would an effective date of like April 15th be a round enough number that has enough time between now and then?
Yeah, I mean, I think that's possible. It's really okay for you all to choose whatever. And the other thing is, we can start to enforce, but we don't have to enforce immediate. We could give people a grace period, like we're doing with the NFG
Yeah.
regulation.
Let's what I like about the 15th is that is also our next meeting. And so we will get all the complaints at the next meeting. And I think that's useful.
Okay.
Great.
I
And
think
so
we
if
need-
something becomes really clear that we've done something horribly wrong, everyone will tell us the first day and no one will have, we can make an immediate amendment if we have to.
Great. I think you need to vote on that.
Okay. So
So
does
moved.
does someone want to move an effective date of the 15th? Betsy has said she
I'll
moves.
second.
Jack seconds. All those in favor?
Aye.
And I want to say all those in favor of the new regulations. I'm not sure I actually ever said that. I know it
Aye.
was voted and seconded. Okay, great. So unanimously passed the synthetic ban and unanimously passed an effective date of the 15th of April.
Good work
All
there,
right.
Chair.
Yeah, thank you, Risha.
I'm trying to say it so that our note taker can have clarity on what just happened.
That's very thoughtful of you. Thank you.
Our excellent note taker.
Yes.
Indeed. Are there any other topics that were not anticipated? I'm not aware of any. Okay. So we have a final period of open public comment. If there's anybody that is attending that wants to comment, they can raise their virtual hand and we will promote them. And I don't see any hands, so we will adjourn the meeting. I really dislike that we have to take a vote to adjourn. Is that how we do things?
So moved.
Yeah.
Jack, are you second in
Yes.
adjourning?
I am seconding and adjourning. Yes.
All right, all those in
All right.
favor of adjourning at 6:33. Thank you, everyone.
Thank you so much.
Bye.
Thank
Bye
you. Have a
bye.
good evening.
Bye-bye.
Bye.
Bye.